So one of the things that we see with people with low back pain is that they have a hard time disassociating their femurs and their pelvis. So what that looks like in real life is when they go to sit down or do a squat, their back rounds as their pelvis goes under. So instead of the femurs being able to move independently on this pelvis, everything moves together. And now your pelvis, pretty well attached to your low back and your spine, that's going to cause this to happen. So every time that person goes to squat, they're putting a ton of pressure on the anterior portion of the disc, as well as posterior segments of the ligaments and things that are holding things together. So add weight to that if you're squatting, or it's something that happens in everyday life. You should be able to disassociate your femurs from your pelvis, so that when you go to squat or you go to sit down, you're able to keep your lumbar spine neutral without putting extra pressure on your low back, and your hips and glutes are able to help control that movement. And it's tough, and you tell people, okay, I want you to tuck your tailbone back or tuck it under, and they don't understand how to do that. So I use two different exercises to help with this, to help them understand that, and also I love using the model because it shows them like this should be able to move without all of this moving. So Amber's going to go on her hands and knees here, and the first one that I like to do is have a stable femur, and then teach them how to move their pelvis on their femur. Okay, so femur is not moving much, but the pelvis is going to be moving. So from here, it's otherwise known as like a cat-cow or cat-camel. They're going to round their back, so push their low back into my hand, and then drop down and reach their tailbone up towards the ceiling. Okay, and come up again. So as you see, the femurs aren't moving, but the pelvis is moving on the femurs. So this is typically easier for people to do, but sometimes they can't do it. So this is a good starting exercise. Now the next one is going to be a pelvic rock. So they're in quadruped, they're in the same position here. The lumbar spine is neutral, so there's just a little bit of a curve here. And what's happening now is we're moving the femurs on the pelvis, and it's relative femoral motion, but the pelvis and the lumbar spine we want to keep neutral. And this is a trickier one for most people to get if they have a problem with this disassociation. But you're going to tell them, okay, keep this curve in your low back and just gently rock back. Good. And then come back. And as soon as they start to curve, you tell them to stop, you ask them if they felt that, and then have them do this again. And this could be done in the mirror, too, if you're doing this on your own. So you can look and see, but we want to be able to feel this, or want our patients or clients to be able to feel what this feels like. Good. Another thing that you want to do before doing this is check their hip flexion range of motion, so that you know that when they do run out of hip flexion range, that's normal that you're going to see this posterior pelvic tilt. That's completely normal when they run out of range, but you need to know where that is, so you can check that first. And then from here, when you feel like they've mastered that, the next step that I would do is have them stand up and put their hands on a wall. Gently bend the knees, reach their butt back, and then from here, they're going to posterior tilt, anterior tilt. So it's a lot more open chain here, and it's a lot more challenging. And this would be the last step, and then they can progress into doing their squats and other functional movements.